Welcome to Computer Talks Pharmacy Forward video series. I'm Maggie Lockwood. I'm here again today with Paul Baldwin, principal of the Baldwin Health Policy Group. And today we're going to talk about digital advocacy, which in pharmacy has always been important. Now the typical way of lobbying for important issues has changed because of our new situation with social distancing and response to the COVID-19 crisis. So Paul today was going to share best practices for using digital advocacy tools. So thank you for joining us again, Paul, and why don't you give us a brief overview?
Thanks, Maggie. Yes, I think when we think about lobbying, we always think about glad handing with emphasis on the hand, the touch, the look in the eye, that kind of thing, and that's sort of been the staple of building relationships, which is the substance of advocacy. And now, we have to learn to advocate now with tools that we may be comfortable with in another context, like, email and video and phone calls and that kind of stuff. But that's going to be sort of our primary means of communication.
Right. And so the key is still building the relationships and using tools we already have.
One of the great things about digital communications is that there's a lot of data about companies that market digitally that can tell us what is successful in digital advocacy. I mean, there's things like, search engine optimization, which tells us in a way how our website's doing, but it also tells us how we're doing in making a connection with individual people. I mean, the healthcare and specifically pharmacy in the sectors that we serve are not independent of government. Nationwide, over 60% of healthcare is paid for by some tax-paying organization, whether it's the state or the federal government. The taxpayers pick up the tab for 64% of all healthcare spending in the United States. That means that policy is dictated by people we elect or by people who are supervised by people we elect. That means we have to, you cannot say, I'm not going to engage in any kind of advocacy. I just want to do healthcare. I mean, and here's the point, the first point to make is that we're all constituents of someone. We are constituents, even if we only have one pharmacy in a remote setting somewhere without too many other people. We are a constituent of a county supervisor, a mayor in a city, a councilman, a state representative, a state senator, a member of Congress, 2 members of the Senate. We are constituents, and being a constituent is part of what makes you that's the entry fee to having influence over a policymaker, is that, I am your constituent. So we all are a constituent, and we have to look at, I think the people we advocate with also have constituents. So we need to be able to help them. I think we're most useful when we help the people we're advocating with understand that we can help them in their efforts to serve their constituents.
The request to, like you're saying, the benefit, who they're really trying to serve. So you're saying,
Right.
Look, I'm helping you help these people, which is going to make
Right.
you look good. So I think that's an interesting mindset to have. And I guess then you could talk about how you use the tools to do that.
Yeah. And so I think that's the key point here, is that when we're going to a policymaker, and we'll make the case in advocacy as a policymaker, whether it's an elected official or someone who works in an agency. And I think that's the first part of education. And advocacy typically is about education. It's about knowing. I mean, here's an example. I mean, suppose you have if you rely on Medicaid, and all of a sudden you find out that because of the virus, the state is having a real serious budget problem, and the thing they decide to do is to cut reimbursement for drugs under the Medicaid prescription drug program. And if you rely on Medicaid, this could be like a nightmare scenario. Now, if you've never before reached out to your state representative or your state senator, you have a lot of catching up to do. But if you've already got a relationship and you say, listen, how many people we serve, You know that the reimbursement isn't the best, but we feel like we have an obligation to do that. We want to figure out how we can do this more effectively. If you've done the education up front, when that issue comes up, I mean, ideally, the first company that your state legislator should think of when the issue of Medicaid pharmacy or Medicaid drug reimbursement or Medicaid drug access, your goal should be the first thing they think of is you.
Let's circle back a little bit and talk about how you build that relationship now if you haven't already.
I mean, the step one is find out who your state representative is. If you're in a fairly large state and the state representative has staff who work on policy, maybe the first person you want to talk to is the person who handles healthcare policy for that state representative. Okay, so email is the obvious one. Now, we know that, the advantage of email is that everybody has an email address. But the flip side of that is that there's so much email that effective email is an art form. You have to sort of reach out and say, all right, I want you to be aware that I run a long-term care pharmacy and I am in your district and I want to make a connection. That you have to be there on a regular basis, and it's almost like a drip campaign of knowledge to say, this is what we do, this is how we do it, this is how it serves your constituents, this is how what's going on in the state capitol or in Washington affects those people who rely on this. Now, so if we think about this as a campaign rather than a particular, just a battle, we think about, okay, over the long period, I want to have that electronic communication, but I also want to have an occasional pick up the phone, talk, and when the crisis erupts, that Medicaid's going in the tank, or some catastrophic thing happens that threatens your livelihood, you have already made those relationships and say, listen, you know what we do. We need help right now because this issue, really has the potential to give us a knockout blow to our business, and we really, and they'll be ready to help.
What about things like LinkedIn? I don't know if that's an effective way to.
Well, LinkedIn is good, and also think about education in the way of doing short. It doesn't have to. It could be an on-demand webinar sort of a thing, saying, health policy person, do you understand this particular nuance of Medicare that CMS has just passed in, or just proposed in a rule? This is how it works. Now, whether you support it or not, you can say, hey, just for FYI, we've looked at this closely, and you should know that this was what this is. And if you can do it in a 5-minute video with a few graphs and charts, and they can look at that at their leisure, or as their time permits, that's a great thing.
Staffers probably don't know. They wouldn't know. So then suddenly you've become a resource for them, and that is giving you more of a relationship, touch point with them.
That's true, especially when you look at members of Congress. That typically a legislative assistant who is a policy specialist on that particular issue is relatively young. They are typically under 30. They may have an issue portfolio of a dozen different subjects. They can't know as much as you know. They rely on a lot of different sources. If you get an email from a congressional staffer saying, how does this issue, we've heard about this from CMS. What do you think about it? Is this a good idea or not? And that shows you've established some credibility. You've gotten to the point where people trust you. Your information is effective, and that's ultimately the place you really want to be as a constituent.
That's the ultimate goal, is to be that expert. Right. So then why don't we put that in context of with trade associations and how you should be doing this work. Pharmacists and owners should be doing work on their own in addition to what trade associations might be doing.
People who run the trade association, they say, who are my noisiest and most and most active members, I better make sure that I pay attention to the concerns of these constituents that I have. So there's, if you know, not to be obnoxious, but to say, to demonstrate to the trade association that you are an engaged, active, committed, well-informed member, they tend to listen to you more than they will if you're not any of those things.
I think that's the best advice right there, is don't let someone else make the decisions for you.
Yeah.
I mean, the independents in particular are business owners, and they know very clear on what they're trying to accomplish. So being involved in this way is an important piece of running their business. Yeah. Well, great. Well, thank you again for talking with us on this topic, and let everyone know how they can find you.
Great. Thank you very much. Yes. We actually have two websites. BaldwinHPG.com is the government affairs website that I started up, and I'm talking about digital advocacy there. But for the industry, LTCpharmacy.net is where we do a lot of our posting on long-term care pharmacies issues. And I'm working now, hopefully be able to announce soon that we're going to have a national long-term care pharmacy directory posted on our site. This has taken a long time to put together because long-term care pharmacies are not always easy to find in the directory. So we'll have that coming up. So
great. Well, thank you.
Good. Thank you a lot. Great talking to you.
Okay.